So now we are going to discuss about disorders and disease of your excretory system. Okay. So there are certain conditions by which you can understand whether you are suffering from the disorders of disease of the kidney. So these condition can be excess of albumin in your urine, okay, which indicate there can be either increased blood pressure, or there can be injury, or there can be infection. Okay. Then presence of excessive quantities of the ketone bodies in the urine. It may be caused because of the diabetes mellitus, starvation, or too little carbohydrate in the diet. Okay. Even sometimes the leukocyte can be present in your kidney. So that also indicate there will be infection in the kidney or other urinary organ. So the very first disorder that we are going to talk is kidney stone. So kidney stone is it is not going to cause the symptoms until it moves around within your kidney or passes into the ureter. Okay. If it become lodged in the ureter, it may block the flow of urine and cause the kidney to swell and the ureter to spasm, which can be very painful. Okay. So there are certain symptoms of the kidney stone. There can be severe sharp pain in the side and back below the ribs. There can be the pain can be radiate to the lower abdomen. Okay. Then there can be burning or paining sensation during urinating. Another symptoms can be seen such as pink or red or brown urine, the cloudy or foul smelling urine. Okay. There can be fever, chills if the infection is there. Okay. So what is the main cause for the formation of kidney stone? Kidney stone is also known as renal calculi. So the main cause of formation of the kidney stone, when your urine contain more crystal forming substances such as calcium, oxalate, uric acid than the fluid in your urine can dilute. That means whenever the water intake is less, so obviously the water get reabsorbed from your urine and your urine tend to become more concentrated. So when the urine is more concentrated, that means urine contain more crystal forming substance such as calcium, oxalate, uric acid. At the same time, your urine may lack a substance which prevent the crystal from sticking together. So that can create the ideal environment to form kidney stone. Okay. So the kidney stone can be made up of calcium oxalate. So it is called as calcium stone. Okay. It is made up of calcium oxalate or calcium phosphate. Okay. And then it can be a struvite stone. Struvite stone is formed in response to the bacterial infection. So if there is a bacterial infection, such as a bacteria which is known as urea splitting bacteria, so these are going to form a struvite stone. Struvite is nothing but calcium magnesium mineral. Okay. There can be uric acid stone. Uric acid stone, right? So the people who don't drink enough water and consume high protein diet, they may suffer from the uric acid stone. Then there can be a cystine stone. So there is a genetic disorder that cause kidney to excrete too much of certain amino acids. So in that case, cystine stone can be produced. So based on the composition, they can be classified into calcium stone or struvite stone or uric acid stone or cystine stone. So you can see these are the kidney stone. So either it can be located somewhere in the kidney. Okay. It can be located in the renal pelvis. Even it can be located in case of ureter. Okay. So based on the location, it can be known as urolithiasis. Lithos meaning is pebbles. So stone in the kidney, ureter or bladder. Then there can be nephrolithiasis, stone in the kidney. Ureterolithiasis, stone in the ureter. So it can be made up of either calcium oxalate or calcium phosphate. It can be made up of struvite. Struvite is nothing but calcium magnesium mineral which can be formed by the bacterial infection. Which bacteria? That is urea splitting bacteria. Then there are certain disorder, right? Metabolic disorder where uric acid stone, even genetic disorders such as when the amino acids are more excreted, like cysteine. So cystic acid stone can be formed. Okay. So the symptoms already we have discussed. So symptoms can be, there can be pain below the rib cage in back and sideways. There can be brownish, reddish, pinkish urine, frequent urge to pass urine. There can be pain during urination. Okay, there can be burning sensation during urination. So, how one can diagnose the kidney stone? So, there can be a different methodology. So, either there can be urine test can be done, or there can be x-rays or sonography of the kidney. These are the different diagnostic tool can be used for detection of kidney stone. Okay, so that is a force disorder. There is one more condition called as uremia. So what is uremia? When the concentration of the urea in your blood is going to increase than the normal level. So normally in your blood contains 0.01 to 0.03% of urea. But when the concentration is above 0.05%, that condition is called as uremia. Okay, that condition is called as uremia. It is harmful and it may result in kidney failure, okay, or renal failure. Okay, then another that is disorder that is called as nephritis. Itis is swelling. Okay, either you can call it as nephritis or glomerulonephritis, or it is also known as Bright disease. Okay, now these disease is characterized by the symptoms such as hematuria, blood in the urine. Then it is proteinuria, protein in the urine. Okay, then there can be odema. Odema is swelling. Then there can be oligouria. Oligouria is less amount of urine formation. Okay, and it is often caused by the bacteria such as streptococcal glomerulonephritis. Okay, which can cause by the infection of the throat, which is known as streptococcal pharyngitis. That means if you are suffering from the streptococcal pharyngitis, there are high chances that these bacteria can infect your kidney as well and result in a condition such as nephritis or glomerulonephritis, or that is Bright disease. Okay, so this is the third condition. That second condition is uremia. Third disease is nephritis. Okay, coming to the another type of the disease called as renal failure. Okay, you can see the renal failure. So what is, these are the common symptoms of kidney failure or kidney disease. Whenever you are suffering from the renal failure, doctor will suggest that you should perform the test for serum creatinine. If there is increased level of serum creatinine in your blood, so that is an indication that you are suffering from the renal failure or kidney disease. Okay, so there can be abnormal level of calcium, potassium, phosphate level. There can be abnormal fluid level in the body. Blood become acidic. There can be hematuria or proteinuria, blood in the urine or protein in the urine. So basically, these renal failure can be classified into two categories. One is called as acute kidney, that is kidney injury, or another is called as chronic kidney injury. Okay, so acute is short term. You can able to see the symptoms within a short period. Chronic is long term. You can able to see the symptoms after a period of gap or after some days. Okay, so this is called as chronic. So acute renal failure, you can see there are can be different causes. There can be pre-renal, second there can be intra-renal, or there can be post-renal. So you can see in case of the pre-renal, there can be sudden or severe drop in blood pressure. It can be because of accidental injury. So whenever you are going to suffer from any accidental injury, okay, so and if there is excessive bleeding, your blood pressure is going to drop. Okay, so that is a pre-renal, sudden severe drop in blood pressure or interruption of the blood flow to the kidney from the severe injury or illness. So first number indicate it is pre-renal. Pre is before. Intrarenal, if there is a problem with the kidney, there can be infection, there can be damage by the toxins, there can be damage by the drugs. Okay, so that is called as intrarenal. Or there can be post-renal. Post-renal is after the kidney. There can be sudden obstruction of the urine flow because of the enlarge in the prostate gland. Prostate gland is present in case of the male. Okay, that is at the base of the copulatory organ. Then there can be kidney stone or bladder injury or bladder tumor. Okay, all these are considered as post renal cause of acute renal failure. Right. So the size of the kidney is going to increase, filtration, blood filtration or glomerular filtrate rate is going to reduce. The condition can be oligouria. Oligouria, when the urine formation become less, more urine formation is called as polyuria. So oligouria, so the urine formation almost become 400 ml. Okay, in case of the children, it is 0.5 ml per kg per hour in children. So kidney function stops suddenly and it can be reversible if immediate medical attention is given. So that is the acute kidney injury. Chronic is long term. Okay, so it can be caused by the diabetes, kidney stone, blood pressure, bacterial infection. Okay, you can see the size of the kidney is going to decreases. Okay, it is going to develop slowly, irreversible, and leads to the anemia. Anemia is low hemoglobin. You know that kidney is also going to release some hormones such as erythropoietin. Okay, and this erythropoietin is responsible for erythropoiesis. Erythropoiesis is formation of RBC. If the kidney is damaged, its endocrine function cannot be replaced. The kidney is not going to produce erythropoietin or calcitriol. Erythropoietin is involved in erythropoiesis. Calcitriol is responsible for bone formation. Okay, so this is all about the renal failure. Hmm? So once the patient uh, is suffering from the renal failure, so there can be a remedy called as dialysis. So either there can be hemodialysis or there can be peritoneal dialysis. So when the renal function fall, that is below 5 to 7% accumulation of the harmful substance in the blood begins. In such condition, the person has to go for artificial means of filtration of the blood, that is nothing but dialysis. Okay, so which is called as hemodialysis. So you can see over here there can be two type of dialysis. One is called as hemodialysis, another is called as peritoneal dialysis. So in the hemodialysis you can see there will be a creation of arteriovenous graft or fistula. Okay, from here you can see that blood is withdrawn from the body. Okay, blood is pumped into pumped from the arteriovenous fistula into the dialyzer. So this is a dialyzer. Can you see this is a dialyzer? Okay, so you can see the blood is removed from the artery. Then with the help of blood pump, it is going to enter into the dialyzer. So that dialyzer has a cellophane membranes, which is an artificial membrane. Okay, so waste product filter from the blood through the artificial membrane into the fluid called as dialysate. So you can see this is a dialysate. This is a blood, that blood contain excess amount of salt and urea. So through the osmosis, this excess, or through the diffusion, the excess amount of salt and urea is removed, which is going to enter into the dialysate. Okay, now the blood has become purified. Okay, so purified blood is going to enter via a vein inside the patient. So this is known as hemodialyzer. Okay, this is known as hemodialyzer. Okay, so in hemodialysis, blood is filtered outside the body using dialysate unit or dialysis unit. So in this procedure, the patient blood is removed generally from the radial artery. Okay, radial artery, which is located near the bone called as radius. Okay, then it is passed through the cell phone tube, which act as a semi-permeable membrane. The tube is immersed in a fluid. You can see this is a tube. which is immersed in a fluid which is known as dialysate, which is isoosmotic to the normal blood plasma. Okay, that means it has a similar concentration, okay, like a blood plasma, but excess of salt can be, that is, diffused from here to here. All right. So the tube is immersed in a fluid called as dialysate. Dialysate is isoosmotic. Only excess of salt, if present in the plasma, can pass the cell phone tube into the dialysate. You can make out over here. All right. So the waste substance being absent in the dialysate move to the blood into the dialyzer fluid. Filter blood is returned to the vein. Okay. Now this entire procedure will require at least 6 to 8 hours. Okay. And if there is a renal failure, if the kidney is not at all working, the patient has to undergo 2 to 3 times uh, uh, for hemodialysis per week. That means that hemodialysis has to perform 2 to 3 times per week. And for one hemodialysis session, it takes approximately 6 to 8 hours. Okay. So in this process, the essential that anticoagulant like heparin is added to the blood while passing through the tube and before resending into the circulation. Okay, because that heparin is called as anticoagulant. It is going to prevent the blood clotting outside the body. Okay, so this is called as heparin, and when the blood is going to enter inside, the antiheparin is added. Okay, so adequate amount of the antiheparin is mixed. The blood has to move slowly through the tube, hence the process is very slow. Okay, the second is called as peritoneal dialysis. So in this method, the dialyzing fluid is introduced into the abdominal cavity. Can you make out? This is the dialysate, which is introduced into the abdominal cavity. Okay, in the abdominal cavity, they are going to make one opening. Okay, or they are going to insert a tube into the abdomen. Okay, and through that tube, that dialysate is introduced inside your abdominal cavity or peritoneal cavity. So this peritoneal membrane will act as a semi-permeable dialyzing membrane, and excess of salt is going to enter into dialysate. Okay, so toxic waste and extra solute pass into the fluid. Okay, you can see the fluid is a fluid and the waste product are drained from the peritoneal dialysis space once the dialysis is done. Okay, so you can see this. This is the solution which is introduced into the abdominal cavity with the help of a tube, that is catheter. Okay, and then that once the excess of salt and urea is going to enter into the dialysate, it is removed from here. Okay, so this fluid is drained out after the prescribed period of the time. Peritoneal dialysis can be repeated as per the need of the patient. It can be carried out at the home, work, or while traveling, but it is not efficient as hemodialysis. Okay, so dialysis is a temporary treatment for the filtering your blood, because kidney is not going to perform its normal function. Okay, so it can work for the filtration of the blood, but it cannot replace the endocrine function of the kidney, because kidney is associated with the hormones such as erythropoietin, renin, calcitriol, which cannot be produced by using dialysis machine. Okay, so calcitriol is required for the formation of bone. Erythropoietin is responsible for erythropoiesis, and renin is responsible for a system called as RAS, RAAS, that is renin angiotensin aldosterone system. Okay, so either the patient can go for dialysis, or another way, that patient can go for kidney transplantation. You can see over here, this is the dialysis. Okay, so you can see the erythropoietin. If the blood oxygen level is going to decrease, kidney is going to secrete erythropoietin, which stimulate the bone marrow to produce RBC. If the erythropoietin are not there, less amount of RBC are produced, and the patient is going to suffer from anemia. Anemia is low hemoglobin. Okay, And calcitriol, it is activated form of the vitamin D. It promotes the absorption of calcium in the intestine and help in bone formation. So the bone can become brittle if that calcitriol is not there in body. So the last, that is called as, one can go for the kidney transplantation. So it is organ transplant of the healthy kidney into the patient with the end stage of the renal disease. Okay, that is the last stage of the renal disease. The kidney transplantation can be classified into two categories. One is called as disease. There can be two type of donor. One is called as disease donor, which is also known as cadaveric donor, or there can be living donor. Again, that living donor can be genetically related, that is relative, or it can be genetically non-related. Okay, so this is the last option for renal failure. Okay, so in order to get the organ or donor, okay, that is organ from the donor, there has to be certain criteria that has to be matched. For example, the blood group should be matched. There are some certain immunogenic tests is done before kidney transplantation. Okay, and if that test are positive, if the blood group is same, okay, if they are genetically identical, in that case the one can donate the kidney to the patient. So this is all about disease and disorders of the kidney. Okay, and here we have completed the chapter, that is excretion and osmoregulation.